Hello, I'm Duncan Muhamira, and welcome back to Children and Not Small Adults. Today, once again, we are in home office, as you can see. Now, in our last two videos, we have discussed COVID-19, different aspects. In our episode 6, we talked about home-based care, how somebody can take care of themselves at home when diagnosed with COVID-19. In our 7th episode, we had a long and in-depth talk, or call it interview, with a specialist in the fields of internal medicine, microbiology, virology, infectiology, and she explained her experience with COVID-19 and a bit of what the studies show in COVID-19. We talked about the D mutant virus, we talked about the treatment of COVID-19, and also looked at COVID-19 in children. Now, today we go a little bit deeper in what are the studies showing as among children. So we are going still in COVID-19 in children, but just a summary of what the studies show, just so that we can all be informed and we can be on the same level as far as COVID-19 in children is concerned. Now, we have reviewed several studies that are done, that have been conducted all over. We have reviewed publications from the CDC, World Health Organization, Robert Koch Institute. Here in Germany, we have looked at different studies, which we will also mention in a bit. And what we see in general is that COVID-19 in children is still generally a mild disease. It presents as a mild disease. Only a small percentage of children get severe COVID-19 disease. However, this also makes children big spreaders. So they are able to spread COVID-19 without anybody realizing it, because they are either symptomatic or they have mild disease. In a large multi-center, multinational study that was done here in Europe, this involved participation of hospitals in Austria, Belgium, Germany, Italy, Portugal, Switzerland, and many others. It's a huge study, and this study shows that in 56% of cases where COVID-19 affected the family, it came from a child. Yeah, it was spread by a child. The index case was a child, and nobody knew it. And so we need to take note of this, that children can spread the disease, and that we should test them also regularly. However, in this study still, 87% of cases did not require any respiratory support or any ICU. So majority of the children were stable, and 16% of them were symptomatic. Now, 50% of the children had a fever or an upper respiratory tract infection. So this still fever and respiratory tract infection, a bit of coughing, a bit of sneezing, majority of the cases. This study was also in line with another study that was conducted in Rome, in Moscow, in Russia, where a number of children, over 37%, presented with fever, coughing, some of them with pneumonia, but not really requiring ICU, and only 2.7% requiring some form of respiratory support or ICU. And this is also in line with the CDC publication. So in general, this is the picture we're seeing. However, the small percentage of children who go on to have severe disease, we have seen a trend that children with core viral infections seem to have a severe outcome. Other risk factors include children under the age of 1 month, so the newborns, children who are adolescents in that age, children with pre-existing conditions, and under this we talk about immunocompromised states like HIV or cancer, We have seen the children with sickle cell disease, congenital heart diseases like congenital heart diseases, and other congenital abnormalities like Down syndrome, children with liver disease, diabetes mellitus, as well as any other immunocompromising states. Male children seem to have a higher risk to have um, uh, severe disease. However, some studies also show that it doesn't really matter what sex the child is. And of course, studies are still going on. Now, which complications are we seeing among children? Of course, respiratory complications. Respiratory failure is one of them, with complicated pneumonias. However, we talked about multisystemic inflammatory disease or inflammatory syndrome, MISC, which we described a little bit in detail with Dr. Costas in our last video. Another interesting complication that's coming out more and more, and that many studies are talking about, is this long COVID syndrome or post-COVID syndrome. And this is a presentation where when children who have had COVID-19 sort of recover or turn negative, they still continue and have symptoms for up to 3 months, 4 months, even up to 6 months. And this is actually quite a troublesome problem, because you think that they're better, but they're not, and the problem continues. Many of the studies done before showed that it happened in adults, but now more and more we see that it happens also in children and also in adolescents. And this presents with symptoms like sleep disturbances, insomnia, sensory disturbances, a continued loss of taste and smell, several stress and psychological problems, headache, fatigue, gastrointestinal problems, and so on and so on and so forth. Among the studies, a UK survey that was done showed that 9 to 13% of children and adolescents still had symptoms more than 5 weeks post-infection, and that was the first thing that was noticed among children who came back for review. In Rome and Italy, they also did a study which had about 129 children who were followed. And this showed that more than half of the children also had these protracted symptoms that stayed behind. And over 10% of them, symptoms were still there after 4 months post infection. In Australia, the same 8% of children in a study with 171 children showed that many of the children 2 months later had this post-COVID syndrome. The good news, however, is that for many of the studies and for many of the cases that have been reviewed, these post-COVID symptoms get better by themselves. However, in a few complicated cases, they may need you to visit a doctor and get a consultation. However, many of them 6 months later tend to resolve, and that is good news. There's a study in Dresden that was done here in Germany, and this study suggests that long COVID occurs much less among children and adolescents than we think, because many of the symptoms can also be attributed to sort of stress and psychological problems that are coming up among children in this COVID pandemic, as their lives have been turned inside out. And so these are all very interesting studies that have come out that we need to keep an eye on. So, in summary, what are we saying? Number one, COVID-19 in children is overall mild disease, with many children being asymptomatic. However, they are big spreaders. They can be the ones carrying COVID and spreading it to everybody. So we need to keep an eye on that and to test them regularly as well. Number two, some children do develop severe disease and require hospitalization and ICU, but that is only a small percentage. Children at a bit of a higher risk to develop this severe disease. We've looked at age, newborns under 1 month, or adolescents around 12 years to 17 years. We've talked about immunocompromised states like cancer and HIV. We've talked about congenital diseases like heart disease and Down syndrome. We've talked about sickle cell disease, renal disease, diabetes mellitus, and children with core viral infections. And among the complications, we've talked about severe respiratory disease, respiratory complications, multisystemic inflammatory syndrome, and long COVID, this post-COVID syndrome. And so this brings us to the end of our talk today. Please remember to subscribe, very important, to keep following us and keep moving with us. And for questions, additions, suggestions, or of topics that you would like us to cover or that you think are important for us to talk about here on Children and Not Small Adults, please drop us an email below. We'll see you next week.